right now. We'll talk about colorectal cancer, the third most common cancer in both men and women in the U.S., as well as the third leading cause of cancer deaths. If you know anything about the Fox Wilmington Show, you know on Thursdays we set aside some time to talk to members of the medical community. Joining us this morning, Dr. John Anagnost, a oncologist with the Cape Fear Cancer Specialists, here to talk about colorectal cancer, among other things. I was going to ask you, and it was kind of there in the lead-in, it affects both men and women. Do one of the sexes fall higher on the spectrum?
No, not really. It's the third leading cancer in both sexes. It's the third leading cause of death from cancer in both sexes. And this is Colon Cancer Awareness Month, which is why we're pressing and pushing for early screening. The key is early screening.
How early are we talking in age for screening?
50 years old as a minimum, and then if you have a family history, younger than that. Just a recent article that came out just in the last couple of weeks from the American Cancer Society in a well-known journal called Cancer discussed what would happen if we just increased our screening rates. Screening is really the key. We know that this coming year there's going to be 130,000 people who will develop colon cancer, and this coming year, in the year 2015, there's going to be 50,000 deaths caused by colon cancer. We know that we can significantly impact on that by doing early screening. And a simple but very powerful statistical model that just came out was that right now we're only screening just a little over 50% of people who should be screened.
As far as the screenings go, I know when people hear cancer, they hear screenings, there's fear right away. Is this an overly evasive process? Is it something that, you know, I'm approaching 50, is it something that I want to think ahead, I don't know if I want to have this done, because that fear is there.
Right. And that fear really needs to be removed. The process is relatively simple. The colon gets cleaned out the night before. The next morning, you're sedated, and then you have colonoscopy. The test is so helpful, so powerful. If we would just increase our screening by a small amount, we could be saving 10,000, 20,000 deaths a year from colon cancer. And it's well worth that effort.
Yeah, I was going to say, again, you know, as I mentioned, I'm 4 years away from hitting the magic number of 50. And I know in talking to people that have had the procedure, and they say, you know what, just get over it and have it done, because while it may be uncomfortable, down the road it is going to save not just your own life, could save countless lives. Doctor, I appreciate the time this morning.
Thank you.